in Generali PanEurope and the clients that we deal with, we do try to encourage early intervention because, as you mentioned, the earlier we're actually notified, we get to the root of the problem and we can help assist the employers
and you can prevent it becoming
a bigger issue.
Yeah.
What other steps can companies take in terms of their absent management strategies? Maybe getting down to the nitty-gritty in terms of some of the actual functions they have, in terms of, are they employing a GP to a GP service for their employees, or maybe an occupational physician, and a difference between those two?
Well, some companies employ general practitioners, and if a company employs a general practitioner, it's very important that the company knows and the doctor knows why they're being employed.
Yeah.
Are they being employed as a GP to look after coughs, colds, back pains and so on at work? And that's fine, that's perfectly legitimate. Or are they being employed to do that, and maybe Joe Soap has been out sick for 2 months, we'd have a look at him and see when is he likely to be back to work. Now there's a contradiction in those two roles. And a doctor, whether a GP or an occupational physician or a general practitioner with an interest in occupational medicine, should not be asked to do both.
Okay.
So if we have in the past taken on roles as general practitioners in companies, but we've always refused to do the occupational medicine role, or if we're asked to do the occupational medicine role, we won't do a GP role.
Yeah.
An occupational physician can't treat and be objective. If you are in a treating role where you're treating an individual who is unwell, then he becomes your patient. You are his advocate. You then can't suddenly turn around the next day and be objective and write an objective report on behalf of the company. You must still remain the advocate of the individual. So a company must know in advance, is this person, are they going to be a GP? And maybe there's good reason to have a GP in the company, treat people, get them back to work quickly. Or are they going to be an occupational physician and provide us independent advice? One person can't do both.
Okay, so there's a distinct difference between that.
Absolutely.
I suppose when the company is looking at their absent management strategy, they need to be clear as what their objective is when they're putting this in place.
Exactly.
I'm aware of some of the activities that Medmark, your own company, have been involved in terms of helping associations or companies implement particular objectives, implementing particular initiatives to reduce absent management and manage that. Can you maybe expand on that and give us some examples of it?
Well, I give you 2 examples. We 2 particular programs, quite diverse.
Yes.
One we have run in a large healthcare facility in South Dublin for a number of years. It's called the Back to Work program, where it's a healthcare facility, so there are healthcare facilities available to staff.
Yeah.
And if you look at nurses, the single commonest reason nurses go out sick is back pain.
Okay.
In any given career, a nurse will probably lose at least 3 or 4 occasions from work due to back pain. So back pain and neck pain is common amongst nursing staff. Nursing staff account for about half of all hospital staff.
Okay.
So in this facility, we looked at the active management of back pain, and this Back to Work program, we first off educated a load of managers and so on to get them, if they identified any employee with back pain, regardless of whether they were out sick or still at work, immediate referral over to the occupational health department, and we assessed them straight away and gave them advice. And the second thing we did was we got a physiotherapist employed on a full-time basis to look after staff. So that if somebody came over, they were immediately referred to physiotherapy, treatment started immediately. And we, in that program, and I can't say that it was cheap, and I remember, so there was a full-time physiotherapist dedicated to it, and we had staff dedicated to keeping these people at work. But it was successful. Successful not in terms of cost, because we didn't look at that, but in terms of reducing the numbers of days nurses lost every year. And we significantly reduced the number of days. So managers are very happy. The second program that we've been running on behalf of a particular employer, a very large employer, is an earlier intervention program. Up to now, with this particular employer, we've been making contact with individuals who've been out sick for 3 months. And by that time, absence behaviours, illness behaviours have become entrenched. And even if you find somebody fit to return to work, it's difficult at that stage getting them back. So obviously early intervention is always a better idea. So with this particular employer, we've now agreed on a 1-month review. So as soon as an individual is now out sick for a month, the employer notifies us, we then contact them by phone. We have nurses employed to find out the nature of the illness, what exactly is keeping them out sick, And the nurse will then give recommendations based on various internationally recognised generic information. So, for example, if you've broken your humerus, fractured your humerus, and you're a plaster of Paris, we typically expect somebody to be at 8-10 weeks, something like that. So the nurse will then say to them, okay, you've broken your arm, we'd expect you back to work in 2-10, 4 more weeks, 5 more weeks, whatever the story is. And that's been quite an interesting thing, because we found causes of absence which are not long-term disability.
Right.
These are early causes of absence, when people have been out a month, are quite different from the long-term absence.
Okay.
So, for example, when we look at long-term absence, we're looking at people phoning them up at 3 months, 4 months, 5 months. About a third to 40% relate to mental illness.
Okay.
In the earlier ones, when we're phoning up, that's as low as 10-15%.
Okay.
And things which don't cause long-term disability, such as pregnancy, we're finding significant numbers in the 1 month. So when we start phoning them up, we'll find that for 25% of women are out with a pregnancy-related issue, whereas that's not the case when it becomes a more long-term issue. And orthopedic and locomotor problems are far more common in the short-term absentee than in the long-term absentee. Is it making a difference? So in other words, is this phoning people up, after when we only had sick a month and getting to go back to work, is it making a difference? Well, the first 5 months of data suggest that it is.
Okay.
We seem to have reduced absenteeism by over 5% in the first 3 to 4 months. Now, I would have to put a proviso on that statement, because there were other factors taken into account at the same time. So there were changes to rates of pay, sick pay, introduced around the same time. So we can't claim all the benefit ourselves, but time will tell what sort of benefit we're having. But it's certainly, early intervention seems to make a difference.
Yeah, so it's part of a package of measures that they actually introduced. So
at the same time.
I suppose for companies that are looking at reducing absenteeism,
it's certainly something worth looking at, because the advantage of a system like this is you can intervene early. And the earlier you intervene, the better. I mean, other methods, tools companies should be using, everybody's work absence must be measured. So in other words, and it must be clear to the employee that their absence is being measured. So if they are out, if they have recurring lates, that they're recorded and the individual is informed that they're recorded. And things such as return to work interviews. So in other words, when they do come back, their manager should sit them down and say, now you've been out for 7 days, 8 days, what was the nature of the problem? Is there anything we can do to prevent this happening again? Was this a work-related issue? Is there anything we can do to, stop this happening again in future, or encourage you to stay at work, and so on and so on? And that makes a difference. There's good evidence that that sort of return to work interview does make a difference.
And from the employee's perspective, that could be seen as a paternalistic, that the employer cares about me.
Yeah, it does. Well, it works both ways, to be fair. Yes, you would think it does, and you do meet the disgruntled employer who's been out sick for 3 months and he comes back and nobody says boo to him, and they say, and they didn't even ask me how I was. But then you also get the guy who comes back after 3 months and they said, oh, no, I was interrogated, So you can never satisfy anybody. But by and large, it seems to be that return to work interviews are beneficial. Employees like them and employers like them.